There are several factors to consider when initiating pulmonary arterial hypertension specific therapy. The first and perhaps foremost is disease severity. But what we mean by that is the more unstable patient is more likely to move perhaps to a prostacyclin end of the range, and the more stable patient is more likely for one of the oral categories of therapy. The second is route of administration. There's not much complexity to taking a pill medication each day, but there's quite a bit more in setting up an inhalation profile or perhaps setting up prostacyclin as infusion. There's issues of patient preference. Quite often patients have researched this, or as we go through the different categories of medication, I may discuss with them the characteristics of each, and a patient may gravitate towards one versus the other. And since there's no single template that says everyone should start it this way, patient preference plays a fairly large role in our selection of initial therapy. There's, of course, physician experience and clinical judgment. Some physicians may be very comfortable and experienced with a certain class and less so with another. So their initial therapy choice may be to start with what they're most familiar with. And then finally, but unimportantly, what about the side effect profile? This can vary for each of the medication class and is something very important to consider as well.